Me?
Yes.
Okay. All right. We're going to wait a few minutes so that everybody who wants to get in can get in. I did not hit record. How do I hit record?
My name?
Okay. Okay.
Teresa.
Okay. It is. Is this recording? Okay. And okay, and how about you guys all got to meet my lovely assistant Brooke. So I just want to welcome everybody, and there might be a pause here and there as I let other people in. I'm going to wait just a few minutes. It's 12:02, and I'm really looking forward to telling you how to fix your own shoulder today. And yeah, first things first, a little bit
How do you turn it up?
Housekeeping. I'd love to know who everyone is that's joined. And so in the chat box at the bottom, if you can type in your first and last name.
Where?
Username. It's probably easier to just write your full name. Some of you, I can see your last name, and others I can't. So I'm going to make sure that I let everybody in. Okay. All right. Okay, so once more, I would love to know who everyone is that is joining me and what their first and last names are. So if you can type it in the bottom in the chat, great. That way I can know your first and last names. So we're going to talk today about the shoulder, what causes shoulder pain, and basically how we get out of it. How many people in the chat, I can see a lot of you. You can raise your hands. I can see you. How many have had pain for more than a year? Yay, I see Linda and Marlene. Okay. How many have had physical therapy before? Okay. All right. Okay, we're going to keep admitting more people. All right, soon I'm going to be sharing a PowerPoint presentation with you. Are we live on Facebook? Okay, we're going to record and post. Okay, great. Awesome. So, great. I see some posts in the chat. And I'm going to go ahead and share my screen. Oops, if I can. Share screen. And then hit there. Okay, and then I think I hit there, right, to get rid of that. Okay, I know what I'm doing. This is
our second time.
Hey, you know what? It takes a while to learn Zoom, but it's cool once you get to know it, okay? Now the other problem is I gotta make sure that I can admit my participants at the same time. Okay, we're gonna admit them all. Welcome everybody. I just wanna introduce myself. I'm Teresa with Georgetown Physical Therapy here in Georgetown, Texas. And I am very excited to have you on board with me today. And we're gonna be thoroughly talking about the rotator cuff, the shoulder, how it gets injured, and how to fix it. And how about the whole concept of being completely pain-free for the rest of your life, not having to deal with shoulder pain. Okay, and I need to say hi to Debbie and Dolores. Thanks, you guys are already my clients, and so thank you for being on with me today. And okay, so
Jason.
You said he put the mail on Sunday for the two small bulls. Should be here on Wednesday.
Let me get rid of
Do
that.
they see me?
Okay.
No, I don't want to turn on.
Okay, good. All right, so.
I can hear you.
Let me get you the next slide. That one? Okay, all right. So this is just a little bit about me. I've been a physical therapist for about 23 years. And I've been here in Georgetown for about 8 years. And hold on. I think we have a few more people that want to join. Looks like 7 more. It's not coming. So, show video. Okay, just was
How do you mute?
okay. I'm going to stop the share for a minute just to make sure that everybody that wants to get on is on. I think everybody's here today that is going to be here. So, okay. There's, can't minimize. Okay. Oh, this one wants to come on. Admit. Okay. All right. So I wish I could keep that up and share my screen at the same time. Okay, we're going to go back to sharing the screen. You're going to watch a PowerPoint presentation that we've put together for you.
Oh, China.
Okay. All right. Okay. Why is it not doing that? There we go. Okay. So Georgetown Physical Therapy is a small private practice physical therapy clinic here in Georgetown, Texas. And we are very different from other physical therapy clinics in the area in that we take a holistic approach. And what that means is we look at the whole body, and we do what I call old school physical therapy. We look at people from the ground up, and therefore resolve long-term chronic problems that other people have not been able to resolve. And so it takes a trained eye, and it takes a lot of patience to retrain body mechanics. And we are experts in retraining body mechanics. So we have some special other tools that we use to help people. We are, I'm a nutritionist, weight loss specialist, and we also have class 4 warm laser, and I am a pelvic floor specialist as well. I've been a therapist forever, so have gotten a lot of skills under my belt and have a very well-trained staff. So moving right along. Okay, why won't this? Thanks. All right. So what is the rotator cuff? And one of the reasons why shoulders are so hard to get fully resolved is that it's really 4 joints in one, not just one. And the rotator cuff itself is a group of 4 muscles, which I'm going to be showing you specific pictures of. And then we usually think of the shoulder as the ball and socket joint, but there's more to it than that. We have to also look at the neck and how it interacts with the shoulder, because a lot of nerves come off of the neck and down into the shoulder, and can cause pain and problems. And we've got to look at the collarbone. We've got to look at the shoulder blade, which is part of the shoulder complex, and we have to look at the rib cage. So it takes a well-trained eye to differentiate what the different problems are in the shoulder. So let me just click on here, then we're going to come over here. Okay, so several of you have answered. You got a lot of emails from me, and we were talking about what your worst pain has been in the last 30 days. And several of you said it's been over 7, it's been over 5. One even told me that it's been 10 out of 10. But what's important to know is, what were you doing when that pain happened? Because if we know what caused it, and if we can reproduce it, then we can fix it. So that's going to be important for you to think about, is what were you doing when you had that pain? And these are some of the things that cause shoulder pain. The number one thing that causes it is usually reaching overhead. Carrying heavy objects, maybe grandbabies and babies, and heaven forbid we have a heavy purse like that. That's the nemesis of the shoulder. And what about heavy lifting? I also see a lot of people who work out at gyms that don't have proper form, and that can cause injury as well. And how about reaching behind your back? Anyone have problems with that? So those are things for you to think about, like what were you doing? Because if we can cause your pain to be reproducible, then we can fix it. Always have to go to the root cause. And there's another thing, getting dressed. Sometimes this puts a lot of drag on the rotator cuff. That's kind of like reaching, right? That's gonna cause some pain. And then sleeping. That's one of the first things that I ask my clients is, what position are you sleeping in? Hopefully you're never sleeping on your stomach. My goodness, that's a shoulder problem waiting to happen right there. One of the best positions we can sleep in is on our back, but we wouldn't want to have our hands up here. And sleeping on our side is typically the best, one of the best positions we can sleep in, but we don't want to sleep on our painful side. So we've got to reverse some habits of a lifetime, but we're going to explain why those sleeping postures are bad for certain reasons. Okay. 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 So Melinda, I hear that you can't hear me. So we're sending you a message to help you. Okay. So there's 3 ways to deal with your shoulder pain. Okay. Basically, you can ignore it, and that's the absolute worst thing that you can do, because it's just going to get worse. You can alter it with shots, surgeries, pain pills, but that's only temporary, right? Or we can handle it. And really, handling it means seeing a therapist that understands the biomechanics of the shoulder and helping you to strengthen it correctly so that it goes away. And it's more than just exercise. That's only about 1/4 of the component of healing a shoulder joint. Okay. So common causes of shoulder pain are, they can stem from a pinched nerve in the neck. And that will typically, when we're dealing with the neck, will send like a burning pain. It'll go all the way down the arm and into the hand. But one of the things that I'm going to talk about most today is something called impingement syndrome of the rotator cuff. I would say 90% of the people that walk into this clinic or that I talk to about shoulder pain actually have a tendinitis in the shoulder joint and have poor posture. And the two go hand in hand, and you can't fix one without the other. So I'm going to show this picture again just to, reiterate that the shoulder joint is a very complicated joint. It involves the neck, the collarbone, the shoulder blade, and the rib cage. And you can't just look at the shoulder alone And that's why it takes a well-trained physical therapist to figure out your individual problem. So the number one thing that we talk about all day long here at Georgetown Physical Therapy is posture and body alignment and body mechanics. And you're going to see in the next slide when we discuss the actual rotator cuff and the shoulder joint that this is an injury. I have 3 things that I want you to take away from this talk today is that we've got to keep good posture so that the ball is on the socket, and slouching is an injury. I can't say it enough. Slouching is an injury. We have teenagers who are 16 years old from slouching and being on their iPhones. They're developing bone spurs in the neck and rotator cuff tears just from slouching. So the first thing we do is take a look at your posture, and we're going to be talking about that. Right now, I'd like everybody, I'm going to show you what I do. I'm going to show you my chair. But I would like everybody to be sitting upright in their chair and learn how to anchor their shoulder blades. Because this is where the shoulder is able to heal when we sit up straight. So remember, slouching is an injury. So here, all right, so this is the shoulder joint. And if you were to come into the clinic, I usually pull out
I'm sure.
the shoulder.
Sounds like somebody's taking a bath.
Right. Look how big that is. That's like it's a big round ball. It's like a golf ball. So Mother Nature made a very mobile joint. It's a big round ball, but it sits on a very shallow socket. So it's almost like a golf ball sitting on a tee. So how easily do you think the golf ball falls off the tee when we slouch? And immediately when we roll forward. And so the only way that this shoulder joint can actually function without injury is to keep what I call the golf ball on the tee, and then we can reach without being restricted. But Mother Nature put the collarbone across the top. So every time you reach your arm, these 2 bones are basically going to hit each other and pinch everything in between if you aren't in good posture and good body alignment. This is a picture of how the ball is held on the socket. This is something called the capsule, and all these individual ligaments is what we call the joint capsule. And what happens over time, if we have enough shoulder pain, is we don't move our arm, and then we get a frozen shoulder. Has anybody here been told they have a frozen shoulder? That's a big owie. That takes twice as long to heal. So that's why we don't want to postpone dealing with the shoulder pain. We want to fix it right away. We don't want this to turn into a frozen shoulder. But for my friends that just came on board, I'm Teresa, and I'm with Georgetown Physical Therapy, and we're talking about the anatomy of the shoulder and how important posture is to be able to get out of pain. The shoulder joint is a big round ball that sits on a very shallow socket, like a golf ball on a tee. And so there's 3 principles I'm going to be teaching you today. We got to keep the golf ball on the tee. Slouching is an injury, and we've got to ice. Ice is medicine. So those 3 principles alone can heal you, but we have to restore what Mother Nature intended. We would not consider driving our car on the road with a bent frame and thinking, hey, I'm not going to have a consequence. And so we can't live in a bent frame without having pain. So everything that we do here is to work on resolving and restoring what Mother Nature created. And yes, I don't care how old you are, we can train new posture and we can achieve it. It doesn't matter how long you've been slouching. So next picture I want to show is this is what an MRI of the shoulder joint looks like. And this is going to give you a great appreciation of the anatomy. So here's a big round ball sitting on a very shallow socket. And look what Mother Nature's done. She threaded a rotator cuff muscle through there. And it's just jammed in between two bones. That muscle is one of the 4 rotator cuff muscles. It's called the supraspinatus. You don't have to remember that, but I would say 90% of the people walking in here, and the reason they are so easy to fix is that, you know, if we can restore posture and you know, you want this space to be as big as possible, but if you, every time you slouch, you're re-injuring this. So think about this getting pinched every time you lift your arm, and this is swollen inside, and it's almost like raw. There has nowhere for that swelling to go. So if you like accidentally hit your thumb with a hammer and it got all big and red and swollen, you would ice it, you would baby it, it would get better in a couple days. But this just gets chronically re-injured over and over again. Every time you slouch, every time you roll on it in bed, every time you reach and you're not in good posture. So we want to first off, you know, improve the ability of it to heal by restoring posture. Because if you continue to keep pinching it all the time, this is what we call impingement syndrome. This tendon is white and it doesn't have very good blood flow. So that means it heals very slowly. So that's why we want to restore this space with good posture, and then icing a regular dose of ice will decrease inflammation in this area. And then here we also have a class 4 warm laser that penetrates through bone that is able to get into this area. Those of you that might have gotten a shoulder injection before, this is where they stick the needle and they bathe this area in a steroid to shrink the swelling. And usually once that shot wears off in about 6 weeks, this all comes back again because we haven't changed the body mechanics and the bad habits. All right? And if any of you have questions, I'm going to answer questions at the end. Okay, so now this is just another picture of the 4 rotator cuff muscles. And I want to show you that the shoulder blade, so these are the 4 muscles. We've been talking a lot about this one that gets pinched. But I want you to appreciate that 4 of those rotator cuff muscles attach into the shoulder blade. So how important do you think the position of the shoulder blade is in getting over shoulder pain? Super important. And the good news is Mother Nature gave us 4 rotator cuff muscles. So if you had a complete tear of this, we can restore full function of your ability to reach, because we'll strengthen and work all these muscles. And we've been very successful in helping people to regain full function of their shoulder and not have to have surgery. It's totally possible. But when we talk about the rotator cuff, we've got to learn to anchor our shoulder blades. And I'm going to teach you that right now, is that if you look at my shoulder, I'm just going to show you, and relax that ball is not on the socket. I want to be able to glide that shoulder back and down and live there. I call that shoulder blade anchoring. Then every time I move my arm, it's in perfect alignment so I don't re-injure it. So that's one of my secrets that I teach the first day, is how to anchor. Okay. So what does successful, non-invasive, natural treatment look like? Because that's what we're here for, is we want to get people back to perfect health naturally without injections, medications, or surgery. And it's totally possible. Here at Georgetown Physical Therapy, we are all trained in something called myofascial release. which is a gentle form of deep tissue massage where we actually restructure your posture. Because what happens when we're slouched all the time is our muscles shrink like shrink wrap. And then we have a hard time getting our shoulders back and being able to assume natural posture. So there's got to be a lot of work on the front chest wall. And everyone here is an expert in myofascial release. Then we talk about, doing what most people think as traditional physical therapy, where we do gentle exercises and stretching. But guess what? Every exercise we do here works on retraining your body awareness so that you're going to overcome a lifetime of bad habits so that we can get rid of the pain and it never comes back. And then we have a secret weapon here that I like to call our magic wand, which is our class 4 warm laser. And this is a picture of it. It's just, it feels like warm sunshine. It comes from Germany and it's able to penetrate up to 6 inches deep, and it instantly decreases pain and inflammation and swelling. It cuts rehab time in half. It's what all the professional athletes have, and we are the first in the area to have it in physical therapy. And we offer one free treatment, and it usually helps to expedite the healing process and set a momentum of healing. It's not totally necessary, but it cuts healing time in half, and it helps our patients who are in severe pain be able to tolerate therapy so that they can continually improve at every visit, because we like everybody to get better, not just plateau. So sleeping correctly and using the correct pillow is super important. And you'll notice she's got perfect alignment of her neck, which is totally related to the shoulder. She wouldn't be sleeping on her hurt shoulder. And then everybody usually has to listen to me a little bit about an anti-inflammatory diet, because most of us have too much inflammation in our bodies, and it's a good way to get rid of the swelling and the deep pain. A lot of times we can get rid of arthritic pain just from changing the diet. And basically an anti-inflammatory diet is a paleo diet, if you've ever heard of that. So that gives us a little extra edge. Believe it or not, you can be bone on bone and be told that you have arthritis. And if you change your diet, that pain will go away. So, and then very important is ice. Ice is like medicine. It needs to be done in a regular frequency and dose. Like if the doctor said, hey, you need to take these antibiotics and you need to take them every 4 hours, you can't just take one today and one tomorrow and expect results. But ice is Mother Nature's anti-inflammatory, and long before we ever had laser, we had ice. And so that means, icing for 10 minutes, 3 to 5 times a day. And there are 3 phases of icing. And, right now when it's so hot, it's easy to ice. But, first ice is cold, then it kind of gets achy and people have a tendency to stop. Well, you just have to get beyond that for a couple minutes, and then that shoulder will go numb, and that's a therapeutic dose of ice. So, but if, it's got to be done regularly 3 times a day for a couple weeks, and that alone, you would probably notice a 50% reduction in your pain. So, those are the shoulder basics of, how to get better. Obviously, I've kind of simplified it. Most people though do need, a physical therapist that can help their specific problem. And, is it your rib cage? Is it your collarbone? Is it your neck? Is it a combination? There's everybody's an individual. So That's why here at Georgetown Physical Therapy, we're a small clinic. We are, able to use proper disinfecting. We actually have an ozonating machine that ozonates the air all day long and disinfects the air. And we also offer telehealth so that, we can look at people even online and at least see what's going on. Because quite honestly, I just can't give you a bunch of exercises because you might be doing them wrong. But this is more on the class 4 warm laser that we just talked about. It's just basically an infrared light that penetrates really deep and causes the cells to start healing themselves. And it's one of our ways that we initiate healing rapidly so that people don't have to come to therapy forever. I don't know about you, but if I was coming to therapy, I'd want to get better as quickly as possible. And I'd want my therapist to be focused on my problems and how to get me better. Because, none of us want to have to come to therapy. And we do want to avoid going out in public as much as possible with COVID. So, interesting. So, what I'm going to do now is I'm going to just show you, if any of you are interested in me doing a private one-on-one free consult with you. This is our website. Our website is georgetownphysicaltherapy.com. When you go there, immediately you can schedule an appointment, or you can call our office and that number will be up. Or if you're interested in, you can either, come in, or I can do a telehealth call and discuss your individual problem with you. You can write it in the chat box as well if you're interested. So, so this is how you get a hold of us. If you, want to go on today, or you get the, after thinking about this for a while, if you want to ever get a hold of us, this is how you get a hold of us. So we have our website, we have our phone, and we have our email. We're conveniently located on Williams Drive. You can just swing on in. And this is a picture of our team. I'm going to minimize you guys for a second. So this is the Georgetown Physical Therapy team, and we are all trained to keep an eye on your body mechanics so that you get better as fast as possible. All right. So if any of you have questions, let's put them in the chat. You just died? Okay, I'm going to pull up. Oops. I'm going to stop screen sharing for a minute. And we're going to pull up our questions in the chat. Okay. Does Medicare and insurance cover this? And yes, we take all forms of insurance mostly. And Medicare does cover physical therapy. It does not yet cover the laser, although Medicare's looking at that. Because it's covered in Europe, we anticipate it'll be covered here. But we always offer a free trial of it so people can try it. One treatment, you should see a 10 to 20% improvement. And we have it in affordable packages. Okay. So I was told I had, have severe loss of cartilage and I need total shoulder replacement. Do you think you could help me? We do it all the time. What happens is when we restore normal body alignment, that shoulder is able to function and glide much better. We have had patients that have been totally bone on bone with literally a ratcheting, and we've been able to smooth that out. Now, was it fun? It was a little painful. I gotta always be honest, But if you're willing to work through pain and avoid surgery, I've seen people completely not have to have rotator cuff replacements. We've had patients that are bilateral amputees, meaning they don't have legs. They've been in bad accidents, traumas, so their arms are now their legs, and we've fully rehabbed those shoulders so that they don't have to have shoulder replacements. So yeah, it just takes it might take a little extra time, and it takes a lot of attention to detail, but we can definitely help that. Is a prescription needed? In the okay, my handy assistant is showing me the questions. So yeah, so in the state of Texas, we're allowed to see patients for up to 10 visits without a prescription. If we're going to bill your insurance, we always want to get a referral. And oh, it's 10 days. It's 10 days, not 10. Okay. Yeah, sorry. So 10 days. So we can get you started, and then we can do an evaluation, send the report to the doctor, and have the doctor sign it. For you that do not have insurance, we do have affordable cash pay programs that we'd be more than willing to help you with, and we could talk to you one-on-one about that. So the answer to your question is we eventually need a referral to charge your insurance, but we have 10 days to do it. And it doesn't have to be an orthopedist. It can be your family care physician. Okay. All right. Let's see what else we have here. Okay. Okay, that's everybody's name. Just red line through mute. Okay. Sorry. Yeah.
She's saying she has pain every time go down a bit more. We're almost there. Got pains between my shoulder and my elbow.
Okay. Okay. So someone else has said my pain is between my shoulder and elbow every time I raise my arm. That is a classic sign of impingement. And you'll notice if you anchor your shoulders and then you do a arm lift, it's going to hurt less. But right now, I'm going to encourage all of you, because I would bet 90% of you on this call already have shoulder impingement syndrome, and we want to avoid reaching above our head as much as possible. We'd want to anchor and use our good arm to reach so we don't injure it. But while you're healing, you want to avoid, you'll notice we call it the painful arc in this range, and we want to avoid that, temporarily for a couple weeks while you ice and recover. Okay. In the state of Texas, physical therapists have 10 days in which to get a doctor's referral. So you can get started in physical therapy without a doctor's order, and we have 10 days in which to contact that doctor and get them to sign off on a prescription, or you can call them and get them. A lot of people have close relationships with their doctors, and all you have to do is go into the portal and request a script. These days with COVID, doctors are more than willing to sign those scripts so that you don't have to come into the doctor's office any more than you have to. Okay, deep pain in the shoulder blade and on your back is always part of bad body mechanics and slouching. So that's simple to fix. Laser would fix that in one visit. But we have to change. I would say 70% of all shoulder and neck problems come with body awareness. And, we're changing a lifetime of habits. And we are particularly skilled in doing that. And every exercise that we do is focusing on not only strengthening, but also changing your body awareness at the same time. So that kind of shoulder blade pain, that's super simple. That's way more simple than shoulder impingement syndrome. Okay. What is our office doing during COVID? Well, we basically have a $2,000 ozonating machine that's constantly circulating ozone and disinfecting our air constantly. We exercise social distancing and we wear masks and we are constantly disinfecting. So I believe our small clinic is way more safe than even going to the grocery store. We're germaphobes. But for those patients who don't want to come in, we do offer telehealth, and there's a lot we can do online as well. And insurance does cover telehealth as well. Okay. And yes, we're hoping that this copy of this video, we're going to keep our fingers crossed, and we're going to be sending everybody a copy of this video. I'd love you guys to be able to remember how to take care of yourself. Okay, any other questions? Yeah, and I just want to invite everybody that's on the call that we do offer free consults. There's absolutely no obligation, so that we can either talk in person or you know, online, so that we can help you to overcome your shoulder pain. And then if you want to come in, you get a free trial of the laser as well. So you got to remember, the laser is a really high-tech machine. It initiates healing at the cellular level, and it's going to start a momentum of healing. And that, combined with your posture and your icing, can make a dramatic improvement. I mean, it really is that simple. And then if you have a skilled therapist to take you through the right sequences of exercises that do not cause pain, you can overcome this tendonitis and be pain-free. So yeah, so thank you. I'm seeing some thank yous posted in the chat. Is there any other way I can help y'all today?
If you want to talk to Linda, call her. She wants to come in tomorrow morning.
Okay, Linda, we're gonna call you and get you in, all right? So we're excited to see you. We'd be really excited to see all of you. You know, as time goes on, this COVID thing will be behind us. And I know your shoulder pain doesn't go away. So, you know, I always think Georgetown Physical Therapy for quality care. And, you know, we don't do just shoulders, we do all body parts. And we take a lot of pride in getting people out of pain as quickly as possible and as economically as possible. Yeah, we have the whole body approach. That's what holistic physical therapy is. So we're here to help the Georgetown and surrounding area community to be out of pain and avoid surgery, medications, and procedures. And we're really good at it. So I say that very confidently as being a therapist for 23 years. And we would love to be your physical therapist, and you feel free to, you've got our email if you want to send any other questions. Be happy to answer them. Just want to thank everybody for attending today, and just let us know if we can be a resource for you. So everybody take care and have a good rest of their Tuesday. Any more questions? Okay. Bye.